as you are. So we will now proceed to the final part of our seminar, the panel discussion with our experts. You will recognize Professor Jean Mack, Professor Nidhi Nagabatla, and Professor Gorik Ooms. The fourth expert will be Hedwig de Koning, who is a postdoctoral assistant at the International Center for Reproductive Health, where she coordinates and supports scientific research. She also works as a child health and emergency consultant at the World Health Organization. She has master degrees in international public health and nutrition, epidemiology and anthropology, and a doctoral degree in public health sciences. Hedwig has been working in international public health, in emergency and development contexts, and she has held positions at the International Committee of the Red Cross, Save the Children, the Université Catholique de Louvain, USAID-funded Food and Nutrition Technical Assistance Project, and at the World Health Organization.
The discussion will be moderated by one of our colleagues, Irfan Loon. Irfan is currently studying global health, and he has already a master in applied psychology and a postmaster's degree in psycho-oncology. So I think it's time now for the panel to get settled around our table, I think. And after that, I will give word to Irfan, who will guide us through the discussion.
For fellowship too? There is a motivation. We are good, yeah?
Nu moet ik nog mijn benen hier op.
Nog dichter als u wilt.
Ja, maar ik ga wat dichter komen. You can see that I'm not used to this thing, but
So, first of all, a very good afternoon to all of you. It's my great privilege to be among the loveliest panels of all time. Thank you so much for this opportunity. Before I start my panel discussion, I would really like to let all of the audiences know that we want this discussion to be very interactive. That's why, if you have questions, please shoot it out. We are here to listen to you. Thank you so much. Professor Nagabatla, if I quote one of your sentences, you said that bringing stakeholders on the same table is like a circus. And my question to you is that you made a very, very well and beautiful case of water management and climate change. But how do you integrate this in terms of policy? And is there any UN mandate currently in pipeline or in practice?
Thank you for the interesting question. I'll maybe start with the point on circus. It's that circus that you watch. When you watch it, you enjoy it because you're getting something out of it. But in terms of these big meetings or gatherings of nations, stakeholders, agents and agencies, what you get is a agreement to do something collectively. And collective action and co-creation these are two good ingredients to achieve transformative change. The pathways for transformative change may be difficult, but once you agree, you make pledges, you make commitments, for example, like the climate commitment, then you are evaluated by your peers. And in this case, the peers are nations. So when you sit in a room and you have not done enough, or you're a student with a bad marks, then you know what happens. Maybe I'll posit that. In terms of global commitment, I think MDGs was a good start. Not that we didn't have the intent before. The Rio conference, the other big environmental events was a good trigger to start thinking collectively. But setting an agenda was something that MDGs sort of provoked the global community to do for the sake of larger challenges of humanity, health-related, gender-related, education gaps in social security services that certain countries had and others didn't. And similarly, I think SDGs for the all it is criticized is giving us another good platform to collectively look into problems that concern more or less the vision of one earth, sustainable future for all. So in this, we have to look beyond our territorial interest and sectoral boundaries to have a thinking where things are integrated. One key example I would give is integrated intersectoral policies. For example, in Canada, where I've worked for many years, we've seen that the water policy or the water agency responsible for crafting national water policies for the national and subnational level is taking into account factors like heat stress, climate anxiety, water crisis related ecological grief. So when you see these words as a part of a national water policy, you feel there is hope. And I think one country sets an example for others to have a more integrated operational measures in form of legislation, in form of policy agendas. Thank you.
Thank you so much. Indeed, very beautifully expressed that it's a collective action and everybody has to get into their gears to actually achieve those sustainable goals. And to the next question, I would really like to go to Professor De Koning. She has seen it all, and I think she's one of the best persons to actually throw a limelight on this topic. How do you see this happening in terms of your work, in terms of your practice, and in terms of future of global health?
Okay, thank you. The introduction was maybe a bit too heavy, but anyway. But let me say, my experience is very much of fragile settings, low income settings. And so I have lived through indeed a lot of programs that have been rolled out in these contexts. And you definitely could see a great shift into first of having this, or when you think of these programs as in national programs, then evolve to these international public health programs, and then now these global health initiatives that really moved from bringing in these elements of indeed systems thinking or comprehensive thinking, sustainability, and as Nidhi said, I think it is great to see how this evolvement has really empowered also at the national levels, creating platforms, not only platforms, but also bringing in there the knowledge that is needed to understand it all, because these are all very complex issues, and really empower these national governments to involve in that discussion as well, and to bring then indeed their needs also to the tables, and to increase their voices, so that it's not only anymore this global north bombarding the global south. So I think these are absolutely fabulous changes. I think what is, for me, what I see as a huge challenge still is that at the national level, the governments may pick this on and have come along and see the need and have the understanding and translate it into policies. But then the next step is very challenging indeed. It is about the translation of these global initiatives, these policies into implementation, and bring it to decentralized levels to the context where it is needed, to the vulnerable beneficiaries who may profit from these initiatives. And okay, I must say my expertise is really in the very poor countries, let's say in the countries with very weak health systems. And then you see indeed that as I said, this trickling down is not necessarily happening. And then very often this is being outsourced to international NGOs who take on, because they are then supported by donors who have they are supported by their programs because they have their strategies that they want to make sure that they happen. So they outsource it to the partners, the implementing partners, the international NGOs very often. And so often bypassing national governments or even national actors. And from just an example from a program that I'm involved in, I think it's really sad to see, like, our project is for really the most vulnerable, the most poor, and still we have so much of that initiative that is evaporating in between because there is a heavy system in place to have those elements outsourced and not involving necessarily the actors, the national actors and the local actors that need to be involved, and therefore sustainability is a big question. Often it is something like it's a donor thing, it's an NGO thing, it is not us. So then, you know, if also, because often these support activities, they are very time bound, so that one knows after 5 years, or if it is already 5 years, you're lucky, but after 5 years, what happens then? Will it then water down and return to how it was before? So these are really, I think, very important issues, and I would like to see, while these global initiatives create a lot of momentum, I would like to see also to have more support and thinking through of how to really translate that and get it to the decentralized levels. So that, I think, I see as a major issue. Yeah.
Thank you so much for beautifully expressing your thoughts, and you have raised very important element like local and national bodies to be involved in those policies. Well, to be honest, my next question was to Professor Jean-Marc, but now I shift to Professor Ooms, because you already have touched something which was kind of my question to Professor Ooms, which is that how do you integrate these national, local, or small scale needs and priorities into policy? How do you do that, and what are the challenges then?
I don't. And that's the easy answer. So I'm a lawyer. I don't know if there are many lawyers in the room. Anyone with a legal background? Okay. So the difference between national law and international law is such that some lawyers say there is no international law. It's not really law. And the reason is simple. There is no mechanism to enforce international law, or there are very few. If you're Iraq and you invade Kuwait, you get bombed. If you're the US and you invade Iraq, nothing happens. And if you're Russia and you invade Ukraine, well, we know what's happening. Because we don't have that. It's at the global level. I think one of the thinkers in international relations I respect most calls it anarchy. It's in a sense anarchy. We don't have that. And so we have these circuses as the next best thing. And that's where the integration can happen, but where also mistakes can be made. And for me, the priority is, if you're serious about a bottom-up approach, is that you start from there and you look at these circuses with a critical eye and say, okay, this can be an opportunity for me. We can make agreements there, but they're not really binding. We can never enforce. So we always have to be reluctant about the promises made there. And what's in for us, and be a bit opportunistic. And I don't know if you can call that a way of integrating things, but The thing I said before of looking at more at common interests for me is a typical way of being critical and at the same time opportunistic. We don't like to see global health as a global health security thing. But global health security funding and promises are perhaps more reliable than right to health or other promises because there is this common interest. And if you go in those meetings that way and you say, okay, we need to figure out what we have in common. I need to be clear about my own agency when I move in and my own responsibilities. For me, that's the balance to be found. Ultimately, as long as we don't have a democratic global government, you have to work with those circuses. I don't really see an alternative. This being said, the most promising networks I've seen on these international conferences are not in the main hall where they do the speeches. It's what's happening in the lobbies and where NGOs get together and exchange information. So yeah, I don't know if that answers your question, but it's the best I can do.
Very well. And just to my personal curiosity, then can I say that you mentioned in the beginning of your topic, we don't know where is the up and where is the bottom. Can we say that local involvement can be maybe up one of these two? Can we say that?
I would make an argument to stop looking at bottom and up and look more horizontal and looking for common interests and common challenges and organize around that, rather than getting stuck in these who's up and who's bottom and how do we navigate that.
Thank you so much. Indeed, there is a great hope for future, but sometimes hopes don't work emptily. For that reason, we should have a solid base of evidence. And my next question to Professor Jean-Marc is that if we have evidence in systems thinking, and which can oftentimes be very complex, we have seen that. And then if I ask you, according to your point of view, being a very active researcher in the field, how do we put these evidences into practice when we want to make policy an actionable, element of it? And what could be the challenges? Just to know that we have a very curious audience here from future global health advocates who would really like to know about it, because it's a very interesting topic and very challenging and demanding at the same time.
First of all, I feel a bit uncomfortable with the term of evidence. Well, there is all this movement of evidence-based medicine, evidence-based public health, and so on, which it's a bit caricatural, but to me, it's relating very much with this view that there is that one size fit all, something like that. And then I didn't explain you well, but this issue of this intervention to this deep prescription, some believe that one intervention, you can apply it in many countries of Europe in that case, but it could be in Africa, Asia, and so on. So the belief that it's possible to identify evidence that can be used everywhere in terms of action, I think it's correct for certain things, but for many other things, it doesn't work. So the issue is not evidence, but the issue is of, I think there's something about, well, I like that, but I'm unable to do so, of brokerage, of transmitting. Yeah, I thought it was time for dance here or something like that.
Oh. It was a phone.
So I go back to my stuff of brokerage, in the sense that the role of people like me ideally should be to help to transmit knowledge from one people to others, but all of us have different knowledge some way, somehow. But to bring this knowledge together, but you need some form of frame of again, of way of looking at the world. That way of looking at the world, it's not, well, you build it by looking yourself at the world and by comparing with others. In other words, you need frameworks, you need theories, and these theories helps you at looking at what we are doing in the world. Something also important, speaking about evidence, I believe also very much in science, in the issue of tinkering or bricolage. In French, we say bricoler. I don't know, tinkering, I think is the word in English. So you don't have a straight planned way of doing things, but you do things by trial and errors, and you learn by doing these things in terms of trial and errors. You start from something very confused, you get to something much clearer after some times. But again, to do so, you don't need evidence, but you need to learn to use the good glasses.
Yeah.
And that's, to me, the key messages.
Thank you so much. This is a very interesting and insightful learning that which I have got from you, Professor. Thank you so much for this. Before I move to my next question, I would really like somebody from audience to please ask a question so that it becomes more interactive.
The last question is a very normative one. Who should? And in my opinion, if health is a human right, then the corresponding obligations fall on humanity. And therefore, you need some kind of international taxation system that allows people, communities, etc., to decide for themselves what the priorities are. Now, we don't have that, but I think it's important to keep in mind. In Canada, they have a mechanism. Every province has a lot of autonomy, creating its healthcare system, very different systems within the same country. But there are transfers between the provinces that are based on the GDP, the average GDP of every. And I think systems like that, if you could have that, then you can create a lot more room for local initiatives and support them. As long as you don't have that, I'm afraid that every international or global effort to support them is a risky endeavor, because you may create a dependency that you cannot sustain in the long run. And so it could be a way of doing harm. And I've seen that in a number of issues, NGOs that have grown, that are doing fantastic work and that have grown very rapidly, but that rely on international funding for 80, 90%. And that makes them extremely vulnerable to then take a position in advocacy that the so-called donor doesn't like. So I would say carefully and yeah, try to support if possible, but I think rather than financial support, it's more creating spaces, reinforcing voices, etc., and avoid a relation of financial dependency that you cannot sustain in the long run. And I know it's a bit contradictory what I'm saying. We should have a mechanism where this long-term sustained support is possible. But as long as we don't have it, we need to be very careful. And I don't know, I mean, I have this experience from SONV, and the way they were working was in an almost anthropological way, that you go into a country in the first 6 months, you do nothing, you just watch and see, and then perhaps you will make connections, etc. And I believe in that kind of approach, but it's very difficult to convince private donors to give you 10 euros per month for that kind of activities. There are some foundations, however, who will support that, who have had many years of experience and who are realizing, I think certainly in sexual and reproductive health and rights, you have a number of foundations who provide really long-term support and leaving enough freedom to the organizations to decide for themselves. But it's a tough one. It's a difficult one.
I hope that answers your question, Eileen. Is there somebody else from the audience who would like to ask, please?
Since the Sustainable Development Goals, which we have which a lot of things have happened. You have had new crises like COVID or like the war. So my question to the panelists, and again, perhaps starting with, so from what if those who are doing this global health policies, I think it's coming up in what recommendation to spend of rethinking what should they do differently in the next global health policy? What is, give me your 3 key recommendations.
To the European Commission. I mean, whenever I try to formulate a recommendation, I try to promote something that I think is useful and that is realistic at the same time. At this moment, to be honest, I'm so deeply disgusted with the European Commission and how it behaved on COVID-19 and vaccines, etc., that my recommendation would be fuck off. I'm sorry, but I'm getting too angry about this. And during many years, we considered the Commission as an ally, and especially because of people like you and others. And the Commission was so important on promoting universal health coverage instead of this disease-specific. But what has happened lately, I mean, it's so hard to understand, even from a common interest perspective, that we're not trying harder to make COVID-19 vaccines or now monkeypox vaccines available. And I'm not even talking about the health system strengthening that is needed to do that correctly. I have the impression that Europe has become as inward looking as the US and promoting Europe first, make Europe great again. And so at this point, I don't know what kind of recommendation I could make. Perhaps think further, get a long-term vision and understand that what you're doing now is so wrong. And perhaps become more aware of how the rest of the world is looking at Europe today and what kind of problems that may entail for Europe in the long run. I guess that's not the kind of recommendation you had in mind. I'm sorry.
Thank you so much, Professor Oms. We can only take maybe one question more, but before I start the next question, I think Professor Oms has very honestly given you a picture. Actually, I think that's needed in global health, to be honest. I think that's the kickoff start, actually, and to see your weaknesses and to appreciate them and to say, okay, this is enough, we will lead further. Thank you so much for this. And next question from the audience, I think, please.
I would write another title and say global health and security. Would you be able to create the same kind of slide between topics that the North or the Western world would like, and other topics that the South won't get. In other words, how do you think that how do you perceive the contribution of the defense forces worldwide in global health engagement?
First of all, it's not my slide. I'm sorry if I wasn't clear about that. It's from Madhu Pai, who's teaching at McGill. It would be a challenge, obviously, to do something similar for security. I think it depends on how broadly or narrowly you would define security, even in health security. I mean, health security is typically focused on infectious disease control, etc. If you want to do it properly, if you want to be able to detect a new emerging disease somewhere around the world, you need a health system that is able to do that. And then if you want to have a real control and treatment effort, etc. So they're not completely opposite. But for me, the most important is to think about security in the long run. And I think what we're witnessing now is an example of that. I think if you see the voting at the UN on resolutions on Ukraine, that is influenced by things we are doing or not doing in health. That is influenced by other things. There is a buildup of anger and distrust that we're not taking seriously enough. And the first time I really became aware of that was in Durban in South Africa, where I saw someone with a T-shirt, a picture of Osama bin Laden, and then with the slogan of Bob Marley, "Get up, stand up for your rights." And I thought, wow, this is scary, that link. And we find it difficult to imagine that huge parts of the world are looking at us. So even if you use it only from a security perspective, I'm a big admirer of Martin Luther King, and in DC there is a stone with some of his sayings, and one of them is, injustice anywhere is a problem for justice everywhere. And I think that's true, and I think we need to become more serious about that. What is happening in other parts of the world has an impact on us. It will be very difficult to negotiate any climate agreement where we are going to need contributions from all people, from all. For me, that's a security issue. That's a security issue for my children and my grandchildren. You cannot unlink it from what is happening in other areas in tax justice. So I think you could make a similar slide. It would take a bit of work, and perhaps first of all, clarifying what we mean with security.
If I can just, not about security, but the discussion that we have now make me thinking that in this type of global health discussion, I think what is really important is to make the difference between value that we defend and empirical data on which we base our discourse. And many times I feel that we mix the two. We say it is like that, which should be like that, as if we would base that on evidence, on empirical data. And if we say so, it's many times because we have value behind us. And I think what is clearly very important in the discourse, the type of discourse that we have here, is to make the difference between, I say that because I defend that, because I'm an activist and I feel that is very important, versus I say that because, well, I have empirical data to, not to prove, but to base myself on this. And this broad discourse sometimes is a bit dangerous because you don't have you have difficulties to see the difference between both.
Yeah, if I can follow, because I've already talked too much. I think this is really crucial, but the separation of norms and facts should not lead to neglecting the norms and focusing on the facts, because the very idea of public health is more normative than factual. It's based on the idea that there is a collective responsibility for health. And if you don't agree with that, there are philosophers who are saying every taxation is a violation of my freedom. We had those discussions in COVID-19. Every mask mandate is a violation of my freedom. This is not about facts anymore. This is about norms. This is about values. And if you don't address those, and if we're not able to come out with a minimum of common values, then you can have all the empirical evidence in the world. You won't be able to reach a common conclusion because they're mixed, and disentangling them is really important to make that first step.
Thank you so much. I hope that answered your question, sir.
There's no answer.
I would really like to ask Professor De Koning, what's your approach on what Professor Ooms and Professor Jean-Marc said? How do you see that in your perspective?
Yes, good. I would like to come back or start from the point of the bottom-up approach, and how I see it being practically done is that you indeed have this community participation. I think in Dutch you have a nice word for it that doesn't translate as well in English, burgerinspraak. Maybe a big word, but it is just having members of the community participate in expressing their needs and their expectations, and also their perceptions on what is being proposed. And I can see quite some NGOs are doing when they try to translate these interventions. They do this social norms assessment where they do. Often these are surveys where they go to the households or the specific target population and asks questions of their opinions and build on that. So this is formative research. So I think this formative research is quite important to understand exactly what is being expected from bottom up, and bring that at the different levels up to the national level, let's say, and so have that voice being heard from the field. I do think that in the NGO world, we are very much supporting this, listening to the voice of the communities, but it's of course then indeed translate that and bring that in practice and see where do we meet each other. And that brings me then to this participation with these different stakeholders when you have discussions of together on and linking to the this lengthy, invest in lengthy discussions where you can express that everybody can express their needs and their ideas, but also do this learning together. I think the learning together is a very important element, and that is something that in my work I bring forward every other second. It is I'm not the expert. You're the expert. You know the context. You know what you need. I can only try to find where we meet each other, and let's then move together and learn together and have this adaptive management, another buzzword, but that really expresses, I think, or that helps to bring that systems thinking into action. Something else that reminds me always, like, oh, how funny, like this Deming cycle of plan, do, verify, act. This is something that exists from the 1950s. And this is still so important to help us in our system thinking that, yes, it is about learning, adapting, and together moving towards a common goal. And if you are not yet at the start together, you take time and you give it time to come together. And I think also for translating policies into or evidence into policies and into practice, it is really putting that into action, I would say. And I think then we can learn from each other and at least try to achieve something that may be more sustainable.
Thank you so much. I think you again raised a very valid point that adaptive learning and learning together is one of the approaches we really neglect in global health arena. And coming to Professor Nagabatla, I would really like to ask you, I mean, this learning together approach, the buzzword adaptive learning, how far is it being considered in your practice, for example, in UN agendas or UN policy making, or any approach with which you deal with water management or global sustainability?
Okay, so I'll address this from the perspective of an international institution who I represent. 1948, when WHO was mandated with the task of taking the global health governance into its hand, they situated the health context within the larger well-being construct. And there was a sense of criticism about it because it's very vague. It's very difficult to quantify what's well-being, and it means different things to different people. And by some kind of direct or indirect influence, the WHO mandate, how it was implemented, adopted by different nation states, as we call them, member states of the UN, was automatically beginning to reflect the biomedical perspective. Health construct, how the national health policies were taking it, was very much constructed in biomedical sense. Though in 1948 it was rooted in the well-being. So 1980s, again WHO made an amendment and came out with different norms that health and well-being nexus should be deconstructed in national health policies in a more wider way. And they also situated the word resilience in that, so health and resilience. So 40 years it took the communities and nation states to even understand how to kind of relate health and well-being. Though today, on basis of logic, it sounds something so logical when we hear it. But anyways, taking that in one side, I think if we have to look forward, and which we should all do, I will take the point from Professor Oms and say that as international governance agencies, institutions, and all the mandates that we have in hand, if we are able to positively influence common values around health, well-being, psycho-social education for our young people, for communities that are stricken by different settings and situations, be it disasters, be it other kind of vulnerabilities that they are exposed to. And then if we are able to understand a common value of well-being, I think that's step number one. Frameworks like One Health is giving us the opportunity to, again, picking your point, intersectoral policies, ecosystem health, livestock health, and human health integrated together into some kind of operational framework, if such can be agreed and deployed. Number three, I think community health. For every small thing, we don't have to run to a doctor, because there is a community sort of health, that notion thinking that we have lost over time. And for example, when I was working with indigenous communities in Canada, I mean, when you have some kind of a grief, when you see a disaster event or you see a forest fire, you don't run to a doctor, you talk to the elders in the community. You seek their advice of how they felt when they saw some things like this. So I think kind of reviving that culture is something that we have to do as global humanity. And I would say that I will finish it with SDGs, which is very core to our day-to-day operational mandate. SDGs with their different thematic goals, like SDG 3 for health, 5 for gender, 6 for water, and so on, so forth, is giving us to organize a multi-stakeholder coalition. And that could be for global health, that could be for global food security, that could be for global water security, energy security, so on and so forth. And I think, so let's make the best of it. SDG agenda belongs to us all. How we shape it, how we implement it, what we make out of it is our onus, it's our responsibility. Thank you.
Thank you so much. And this was our last question for the panel discussion. And I'm sure that we had some enriching and insightful thoughts from all our panelists, which I would really like to thank again for giving their time and giving us opportunity to listen to them and maybe try to think or rethink again when we talk about global health challenges. Thank you so much.